Good evening, ladies and gentlemen, members of the media, and also colleagues who are tuning in from your homes. I would like to welcome you this evening with our announcement from our Permanent Secretary for Health and Medical Services, Dr. James Fong, Chief Medical Advisor, Dr. Temesa Tunrabu, and the Head of Health Protection, Dr. Alicia Shaukan. My name is Rusiati Valelevu, and this evening we will be just making an announcement from our three doctors, and then we will advise on further decisions for a press conference, which is yet to be confirmed. So without further ado, we will now hand over to our PS, Dr. Fong, to give his announcement for this evening. Thank you, sir.
Minaka Rusi, Mula Fiji. I'm recording this message at home, where I'm under quarantine as a potential primary contact of one of our medical team members who contacted COVID-19. We say our health teams serve on the front line for a reason. Even when we follow the rules and employ proper PPE, there is always the risk of exposure in the line of duty. I want to thank my teams who are continuing to guard the well-being of our people. Their service and sacrifice have never mattered more. I have tested twice already during my quarantine on day 1 and day 4. My being home is simply a precaution. I also want to thank the members of the Department of Information who have helped me record this message without coming into contact with anyone else. We have 35 new cases of COVID-19 to report today. This is the latest update in a record-breaking surge over the last several days, with a majority of cases among known clusters in the Central Division. So whilst many of you may find the number 35 a bit lower than usual, it is not a sign of improving status or otherwise. This is just a number today. We are continuing in these escalating numbers of COVID-19 happening in the Central Division. After an entire year without a local case of the virus, I know these double-digit daily case numbers are unsettling news for many of you. And they should be. This is a highly transmissible and deadly disease. But there are ways we can protect ourselves. If you are one of those who has not been taking this outbreak seriously, and I know some of you listening are, it's time to stop being careless. I've gone over the rules before, and I will again. Stay home as much as possible. If you do leave, wear a mask, and make sure that the Care Fiji app is installed in your phone and Bluetooth is switched on. Keep a 2-meter distance from others. Wash your hands often. Do not share cigarettes. Do not share takis. I love sharing grog as much as anyone, but it's time to put that habit on hold. Grog by yourself, mix your own grog, and taki to yourself. If you and your business are already adhering to these good COVID-safe habits, thank you. Please keep them. If you are using your platform on social media or in everyday life to remind people of the life and death importance of respecting our health protocols, please keep it up. There has never been a higher level of risk in the Lami containment area than today. Everyone knows it, and everyone must act accordingly through the good health practices we have advocated from day 1 of this outbreak. I also want to be clear. There is nothing reassuring about the low number of severe disease and death recorded so far. This is the same variant that has inflicted mass death upon many other nations. It can kill. Do not listen to the false prophets and the pseudo-experts who say that this disease cannot harm you. They are lying, and they will lead vulnerable Fijians into ICUs and, in worst case scenario, an early death. We shouldn't have to force anyone to take the obvious steps that are necessary to keep ourselves safe and healthy. Don't wait for more deaths to hone your discipline. While we continue to publish the location of new clusters, no one should base their adherence or lack of adherence on whether they are near a cluster or a red zone or whether they're in a green zone. We are dealing with community transmission. That means the exact source of every case is not known. The person sitting next to you could have COVID. The person you speak to could have COVID. So while we continue to employ targeted lockdowns, everyone in Fiji must adhere to COVID-safe protocols. The Central Division is seeing the biggest spike in case numbers, but we are not. The Central Division is seeing the biggest spike in case numbers. But if we are not extremely careful, we could see severe spikes in many other parts of Fiji. We have previously employed mobile screening teams to great effect, but the scale of this outbreak now requires a different approach. I have mentioned in yesterday's press conference about the need for us to go into a mitigation phase. Please know this, we are guided by two objectives. Keep already infectious and potentially infectious people safely away from the public, and provide life-saving care to those who do develop a severe case of COVID-19. We will now be maintaining our stationary screening clinics and saving our mobile teams to do contact tracing, screen in areas of concern, and deploy it to homes that report individuals with COVID-like symptoms. If the individuals test positive, they will be placed under home isolation with groceries and household items provided. If they develop severe illness, they'll be transported to a hospital. So please, if you feel symptoms, call us at number 158, get tested, get protected with the care that you need now. Don't muck around with your health or the health of your loved ones. It is important to understand that this move to a mitigation strategy is tailored to the scale of the epidemic. With our partners across all government, we are ensuring that our response is contending with the reality so that we can provide you, the Fijian people, protect you, the Fijian people, from an evolving outbreak. The mitigation measures will mostly be in the Central Division, where containment measures are focused mostly on positive cases and contacts. Fijians in the West and in the North and everywhere in Fiji must continue with COVID-safe measures. It is therefore extremely important for people to understand why we need to carefully manage movement from contained areas to uncontained areas. We sympathize with your need to relocate, and we are working hard to develop protocols that will allow you to move without risking further transmission of the virus. I hope this gives everyone an idea of the short-term epidemic outlook. Longer term, our path out of this crisis is clear. We have to protect as many Fijians as possible, as quickly as possible, through safe and effective COVID-19 vaccine. That means getting as many jabs in as many arms as we can. More than 225,000 have already received at least one dose. That's an excellent start, but we need to immunize more. And we need everyone who has received one dose to receive the second dose when it is due. That is our best possible defense against the wave of hospitalizations and even deaths that could be headed our way. Please register to be vaccinated. If you register beforehand, you will not spend as much time in the queue when it is your turn to be immunized. That's our preference, that you register beforehand. But if you do show up without pre-registering, you must come with the right documentation that can verify your identification. The rest of the world is protecting their people through vaccines and reclaiming the lives they knew. These nations are dealing decisive blows against this pandemic. Fiji must join them. We cannot leave ourselves vulnerable. We cannot leave ourselves behind. We cannot leave ourselves stuck with the socio-economic consequences of the pandemic forever. When it is your turn to be vaccinated, come forward. I have received my first of the 2 doses of a vaccine. I did it because it's the safest, most responsible, and most patriotic choice we can make for Fiji and for our fellow Fijians. I'm looking forward to receiving my second dose once my quarantine period is over and become fully protected. We'll let everyone know as soon as they are able to be vaccinated. Thank you, Fiji. Stay safe and always keep the faith. Coming on next will be Dr. Alicia, and she will be able to discuss some of the laboratory data that we have so far. Thank you, Dr. Alicia.
Thank you. So just similar to the permanent secretary, I am also speaking to you from home quarantine after I've been identified as the primary contact of a COVID-19 case at work. I've also tested negative twice so far, and I feel well. So just to summarize, the permanent secretary has announced 35 new cases today. 26 of these new cases are linked to the following clusters. So to the COVID-19 incident management team, there are 5 new cases. CWM Hospital, there are 18 new cases. Navy, there's 1 new case. Nawaka Nadi, there's 1 new case. And Caubati, there's 1 case as well. 9 cases are currently under investigation to determine if they have any links to other cases. These 9 cases are from Lami, where there are 2. There are 2 in Nasinu, 2 in Valelevu, 2 in Koronivia, and 1 in Toorak. 15 patients have recovered, which means there are now 624 active cases in isolation. There have been 810 cases during this current outbreak that started in April of this year, and we've recorded a total of 880 cases in Fiji since the first case was reported in March last year. There have been 249 recoveries and 4 deaths due to COVID-19, and a total of 3 COVID-19 positive patients have died from pre-existing non-COVID related illnesses. A total of 93,066 samples have been tested since this outbreak started in April of this year, with 135,927 tests since testing began in early last year. 3,200 tests have so far been recorded for June the 8th, and this number is expected to increase as we get more testing number data from labs. Our national 7-day daily testing average is at 3,107 tests per day, or 3.5 per 1,000 population. So we are testing at a high level as we had targeted. The national 7-day average daily test positivity, so out of all the tests we do per day, average over the last 7 days, our average positivity, the number of tests that turn positive, is at 1.9%. And this is increasing along with the increasing cases that we're seeing primarily coming from the Suva-Lami Nosori corridor. I would just like to say that I know that there is concern about the number of frontliners, especially frontline healthcare workers, that have been recently reported as being infected with COVID-19. The members of our COVID-19 incident management team at Ministry of Health headquarters are some of these that have been impacted by the virus recently. This concern is understandable. I know what you're thinking. How are they getting infected? Aren't they following the advice that they're giving us? Well, first of all, COVID-19 is a very transmissible, contagious virus. It spreads very easily, and it spreads easily in crowded and confined spaces. We advise you to wear a mask because we know that the virus can be transmitted through the air in these confined spaces. So anywhere indoors, really. The typical office setting, when a significant number of essential service staff do work, unfortunately tends to be a closed, confined space. All the advice that we give you is to reduce your risk of catching the disease or spreading it to others. Stay home as much as possible. If you do leave home, please wear a mask. Keep a 2-meter distance between yourself and others. Wash your hands often. Avoid crowds and crowded places. And don't attend social gatherings. Behave as if anyone you meet outside your home potentially has COVID-19. And if you are carrying out approved work outside your home, avoid eating your lunch with others during work. Why? Because you have to take your mask off to eat lunch. And most offices have a common office tea room, and that is a potential source of transmission within these office settings. All of these measures will help you reduce your risk, but it may not eliminate the risk completely because of the contagious nature of this disease. But out of all the advice, the one that will protect you the most from getting COVID is to stay at home. Medical staff, frontline healthcare workers, we can't stay home. If our frontline workers stayed home, there would be no response to this outbreak, and there would be nobody left to care for sick patients in hospitals, whether they have COVID or not. They protect themselves as best as they can. For example, our contact tracing teams and our vaccination teams wear the appropriate personal protective equipment when they're in the field. And these groups are swabbed more often than anyone else in Fiji, usually about twice a week, which is why we're able to identify them as cases so quickly. But they can't stay home. They are out there every day, whether it be directly caring for patients in health facilities, conducting swabbing of suspected cases at all hours of the day, working in laboratories, or coordinating the response to the outbreak at the IMT, Administrative Health Headquarters. Many of these people have not seen their families for weeks on end as they work and live together in bubbles to protect essential healthcare services. With escalating cases in the Lami Suva-Nosori containment zone and clear evidence of widespread community transmission in this zone, they and we will still be here. As the Permanent Secretary has described, we are shifting our strategy to tackle the escalating challenge, but none of us are giving up. We urge you not to either. And if you haven't been listening to the advice given, please do so now. Stay home as much as possible. If you do leave home, please wear a well-fitted mask. Keep at least 2 meters between yourself and others. Wash your hands often. Avoid crowds and crowded places. Don't attend social gatherings. Don't meet up with friends. Don't visit family outside your household. Behave as if anyone you meet outside your home has COVID-19. And if you have a smartphone, download the Care Fiji app and keep the Bluetooth on. This will help our contact tracing teams if you become a case or you come in contact with a case. And please get vaccinated when you can. I headed the task force that brought 2 outbreaks under control in the last 4 years. This was meningococcal C and measles. Both these outbreaks were brought under control by our contact tracing teams, but most importantly through vaccination, because our people, the Fijian people, came out in droves to get vaccinated if they were in the target populations. I've received my first dose of the COVID-19 vaccine, and within a few weeks, I'll receive my second. Please, please get vaccinated. Thank you.
Naka PS and Dr. Alicia. Bulabnaka again. So today is 52 days since the Honorable Prime Minister announced the first case of COVID-19 second wave of April 2021. Since then, we've cumulatively diagnosed 880 cases, of which 249 have recovered. We currently have active cases in our hospitals, in our community isolation facilities. There is a group that's looked after in our home isolation, under our home isolation protocol, as well as those that are awaiting retrieval. Services continue in spite of the challenges faced by our health team in the area of surveillance and contact tracing, isolation and quarantine services, inpatient care in our hospitals, and of course, vaccination. In the last 24 hours, our stationary clinics continued to see cases, to screen cases, and in the last 24 hours, some 4,708 individuals were screened with 512 swabbed, giving an cumulative total of 6,815 who have been screened to now screening stationary screening clinic, and 14,443 have been swabbed. As stated by PS evening, the mobile community screening will be will now change and will be changed to as we pivot to mitigate the impact of the outbreak on our health services. CWM Hospital has now been designated as a COVID hospital, very similar to we had designated Lautoka Hospital as a COVID hospital a few weeks back. And supporting the CWM Hospital, we now have the FEMAT Field Hospital at the Vodafone Arena in Lautala Bay, covering for non-COVID cases. So COVID are admitted at CWM Hospital, non-COVID cases admitted and cared for at the FEMAT Field Hospital for those of us who live in the Central Division and in particular the Suva area. We have mobilized staff and the North to assist the Central team in a very similar manner that we had mobilized staff from the North and the Central Division to support the Western Division when the outbreak was high in the Western Division. Statistics from our vaccination team in the last 24 hours revealed that some 12,346 individuals received their first dose, while 136 Fijians received their second dose in the last 24 hours. And as stated by PS, this has now improved our coverage of vaccination to at least more than a third of the population, of our target population, who now have had a first dose of the vaccine. So we have the staffing number to address the situation at hand. We are building up and have been building up in the last month, in the last few months, our capacities, our hospitals and our health facilities with equipment and supplies to support our response to the outbreak. We've also worked very closely through the whole of government approach with various government agencies and the discipline forces that have been supporting our response. But this will not be enough if the case numbers continue to rise every day beyond the capacity of the health service. It will not be enough. So we will need the help and the support of the community. Every member of the community needs to do his or her part so that we can bring this outbreak under control. And our part is very simple. We need to follow the advice on the public health measures we put out regularly and every day. With PS and Dr. Saukan have mentioned it again. Stay at home and only move for 3 reasons: food, health, or medical reasons, and for essential work. When you are moving, you must wear a mask at all times. Wear it properly and wear it whenever you are out of your home. Practice social distancing. Wash your hands at every opportunity and keep your Care Fiji app on. The health workers are able, they are committed, and they are willing. The frontline workers are willing. The discipline forces are willing. The community should also be willing to work with us. We should work together to stop this virus, because together we can. Thank you very much. Valelevu, and good evening.
Thank you very much, Dr. Tondravu. Thank you, Dr. Lisha, and also Dr. James Fong for the announcements tonight. Ladies and gentlemen, members of the public, thank you once again for tuning in tonight. And we hope that all the information will be taken into our different households to help us make our decisions. We thank you once again. We thank the three doctors, PS, and we hope that we will be coming back for more announcements and hopefully press conference with members of the media. Nawalevu, and have a good evening.